Iboan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando and this is your weekly dose of wellness here on Healthline. And a warm welcome to all our viewers joining across the globe via YouTube as well. Today we are going to be discussing a very important topic, a condition which is quite prevalent and the incidence is on the rise with the current lifestyle that we have in the society today. This is none other than the condition of high blood pressure. We in the medical community refer to it as hypertension. To talk about this topic, I have invited consultant cardiologist Dr. Chamara Ratnayake. Very good evening to you, sir. Thank you for joining us here on Healthline.
Thank you, Dilshan. Very good evening to you as well.
So, to get into the topic of high blood pressure, sir, because sometimes the lay community thinks that blood pressure per se is a bad thing. So, if you can just elaborate what is blood pressure and what would be the normal blood pressure that a person should have and when should a person really get worried?
Okay, yes, that's a very good start to the topic, I guess. So we should know before we talk about abnormal things. I think it's important to know what is normal. I think that's quite a good start. So blood pressure in general. So the blood pressure is something that we measure in people day to day, and basically what we mean by blood pressure is the pressure that is there inside the blood vessels of your body. And the blood vessels need a certain amount of blood which pumps through your heart to maintain oxygen levels in all of your organs from head to toe. And if you don't have adequate blood pressure and hence adequate oxygen levels to the organs, that can cause trouble obviously. So we need to have a reasonably normal blood pressure in our body, and that is again, the blood pressure is regulated by your heart, basically the amount of blood that is pumped out of your heart every second, every minute essentially. So to answer the question also, what is normal blood pressure? So we again measure this with our different blood pressure meters and monitors, etc., and we go by the metric millimeters mercury. So again, if you were to say what is a normal blood pressure, and we have two levels of blood pressures, if you also obviously you know, and I think our lay community also know, we call it, one is the systolic blood pressure, which is a higher value, which is where the blood pressure when the heart actually pumps blood out, and that should be around 120 to 130 millimeters mercury. And then we also have the so called diastolic blood pressure, which is the lower value as we call it, and that the diastolic blood pressure is the blood pressure in your blood vessels when the heart is relaxing, because the heart has two functions, it pumps and then it relaxes. So this diastolic blood pressure value should be in the range of 80 to 85 millimeters mercury. So those should be your normal blood pressure values.
Right. So now that we have defined what should be normal, can we get into what is abnormal? What is hypertension? What is high blood pressure?
Yes. So high blood pressure, again, as the name suggests, obviously when it's higher than what it should be, and we go by again the different levels of whether it's the systolic blood pressure or the diastolic blood pressure. So if your systolic blood pressure is persistently elevated above 130 millimeters mercury, if you take an average, or if you are taking just one off measurements, 140 millimeters mercury, or if the diastolic blood pressure, the lower value, is higher than 85 millimeters mercury on average, or if you take one off values, if it's more than 90 millimeters mercury, that would be considered to be hypertension or high blood pressure. However, Dilshan, I must just elaborate a little bit more on this as well, because it's a difficult thing to sometimes comprehend, because because there are a lot of people who come to us as in our clinics also, who have had like one blood pressure reading that the blood pressure was high, or above 140 systolic or above 90 diastolic, and they kind of panic. So sometimes we kind of have to tell them that just a single reading of a blood pressure of more than 140 or 90, it does not define hypertension or high blood pressure. We need to have repeated measurements, and that's why I said very specifically persistently elevated high blood pressure should be found to be diagnosed with hypertension. So, we actually say if it is one-off readings, at least 3 measurements, maybe a few days apart, maybe 2 to 3 days apart, where it is persistently elevated, then we can consider that this is hypertension or high blood pressure.
So, that is a very important point that Dr. Chamara Ratnayake brings across to our viewers. A single reading of high blood pressure does not mean that you will be tagged as a hypertensive patient lifelong. We need to follow. It may be a red flag, it may be a sign that your blood pressure is elevated, but it requires a certain amount of follow up. Continuous high reading may give a sign that you are hypertensive, but that would be a red flag for you to go and consult your doctor to get it properly checked out. Now, sir, in my introduction, I said hypertension is very common, it is on the rise, but if you really talk about numbers, how is it really? Is it actually on the rise? How does Sri Lanka compare with the Western world?
Yeah, I think that is important to know as well. So, hypertension numbers are definitely on the rise, I can definitely vouch for that as well. And if you look at numbers in Sri Lanka, the WHO actually has given some new data which has shown that about 25% of our population, so that is about a good 5 million people are known to have hypertension or high blood pressure. So, that is quite a significant number, but again I would just like to elaborate a little bit more on this again from the WHO. There is, although about 5 million of our population have found to have high blood pressure, quite surprisingly and quite worryingly, only about 10% of those people actually have that blood pressure adequately controlled, and that can be quite problematic, especially in years to come. It can lead to complications. So, that is something that we need to be aware of, and again awareness is through these type of programs actually. So, I am very happy that you are talking about this in your program as well, because I think we need to create a lot of awareness in the general population about hypertension, how prevalent it is, and obviously to get people checked to see if actually they have blood pressure, and if they do have blood pressure, whether they have it actually properly under control or not.
Definitely 25% of the population being hypertensive is quite a worrying fact, and it is not just a number that appears on the blood pressure meter, it has very significant impact on your entire health and well-being. So, talking about blood pressure, sir, what would be the risk factors which might predispose towards this condition? I am sure most of our lay community knows some of the very common risk factors, but for the benefit of everyone, if you can just give us an elaboration on what the risk factors are.
Yeah, so again that is again very important to understand as well. And so, Dilshan, basically high blood pressure, if you were to talk about risk factors, or if you were to ask me about what causes high blood pressure essentially, I would have to say, and this is again obviously common knowledge, 90% of people have high blood pressure without any reason at all. It is just a genetic predisposition, it is kind of comes in the families basically, there is no real reason as to why they get it. However, there are certain risk factors which will, as you said, predispose people to have higher blood pressures, and we can divide them again into so called modifiable and non-modifiable causes. So, modifiable means things that we can change or we can get things controlled, but non-modifiable means that we cannot change them. So, the modifiable causes of high blood pressure, some common things, for example, smoking, again something that we can obviously change, increased alcohol intake again can lead to higher blood pressures, obesity or people who are overweight, that can again lead to high blood pressure, etc. So, there are quite a few of those, but those are probably the 3 commonest reasons or risk factors as far as modifiable risk factors are concerned. The non-modifiable risk factors, if I were to say so, would be increasing age. So, as you grow older, your arteries get stiffer and that can lead to high blood pressure. Also gender wise, there is a predisposition from males actually, where males are more pronounced, more at risk of getting high blood pressures. But the most important one, as I said earlier as well, as non-modifiable or something that we cannot change, is genetics. So that is the most common reason to get high blood pressure.
Yes. So smoking, alcohol and obesity are some of the modifiable risk factors that predispose towards high blood pressure. So if you are diagnosed to be a hypertensive, or if you are engaging in smoking, having a lot of alcohol, consuming a lot of alcohol, and if you are gaining weight, if you are more towards the obese side, it's time to take control of your life and change those things, because those, as Dr. Ratnayake correctly said, are modifiable risk factors which we have a certain control over. Now, talking about the risk factors, you mentioned the genetics, the familial tendency towards having high blood pressure. So, if a person has had a strong family history of high blood pressure, when should they start screening? Do they need to screen themselves, and if so, when?
Yes, I think it's very important to screen themselves, and obviously to find out whether they are having high blood pressure or not. Unfortunately, I can't give you, I can't put a finger on it and say, Dilshan, they have to check their blood pressure at a certain age, because we never know as to at what age they can crop up. However, as a rule of thumb, I generally say, at maybe following the age of 30, it's always a good idea to get yourself checked, and it's not a complex procedure, isn't it, to get your blood pressure checked. It just 30 seconds of your time to either ask a doctor to get your blood pressure checked, or nowadays it's quite frequent where we have these electronic machines, and if it's a good machine which is properly calibrated, we can usually have reliable results from it as well. So I would probably say if you are 30 years or above, it's a good time to get yourself checked as far as whether you have blood pressure, especially, as you said, in those who have a strong family history of high blood pressure. I think following the age of 30 is what I would recommend.
Right. Now, talking about screening and checking this blood pressure regularly, sir, we know that blood pressure is not a very static measurement. It's quite dynamic depending on the situation and physical exhaustion, so on and so forth. So, if a person is to screen themselves, either to go to a doctor or check the blood pressure at home with one of these electronic monitors, what would be your advice on how they should go about it?
Yeah, so again, I think it's important to get it accurately diagnosed. I think that's the word that needs to be used. So as I said, there are multiple ways to do it, and a lot of people do get themselves these blood pressure monitors at home, and especially the younger people who have parents who have high blood pressure, they will have a blood pressure monitoring machine at home, and they will probably check their blood pressures themselves. But again, I wouldn't recommend doing it for the first time yourself, because obviously you need to know how to do it, the technique, etc. So to get it accurately checked, I would always recommend that you go to a doctor, your family doctor or a specialist, it doesn't matter, and to get it accurately checked. And further monitoring, of course, you can do by yourself once you are adequately trained to use these blood pressure monitors yourself. But the best thing is to obviously get it checked by a qualified doctor. And again, as I said, and a single measurement, as I said before, don't worry about these single blood pressure measurements that can sometimes show high readings, which could be a false high as well. So actually the recommendation, and this is the ideal circumstance, is to be properly and accurately diagnosed with hypertension or high blood pressure. What we recommend is what we call a 24-hour ambulatory blood pressure monitor. So basically what it does, it is again an electronic blood pressure monitor where we fix it onto a person, and it continuously monitors the blood pressure over a 24-hour period, and then we get calculations. We can fix it onto the computer and we can get different calculations. We get the 24-hour average blood pressure, and that is the most accurate way and the most reproducible way of knowing whether you have high blood pressure or not. And it also gives values of daytime versus nighttime blood pressure, because the reason is, again, there should be a variation. So, your blood pressures are usually higher in the daytime and it should be lower in the night time. And if there is some reversals, for example, where the pressures are higher in the night, that can also lead to certain complications in the future. So, we can get an idea as to how the blood pressure behaves over a 24-hour period. So, that is the recommendation.
That's again very valuable information for our viewers, because in our day-to-day practice, when patients come to us and talk about blood pressure, they do not really understand this variation of blood pressure. They seem to think that one pressure will continue throughout the day, and of course, like Dr. Ratnayake said, this 24-hour blood pressure monitoring is very valuable in getting a very accurate idea of the variations and how your blood pressures fluctuate throughout the day. Now, talking about blood pressure, sir, if a person is to develop high blood pressure, what would be the symptoms and signs? Are there any symptoms and signs, and if so, what should a person be on the lookout for?
Yeah, I'm actually very happy that you asked this question, because it's something that I always speak to my patients about as well. So, quite surprisingly, again, Dilshan, so you are quite correct in asking, are there symptoms? Majority of the time, and overwhelming majority, 80% of the time, patients who have high blood pressure actually do not have any symptoms. It is asymptomatic, as we call it. They are perfectly fine walking and sitting like you and me actually. So, you do not notice it at all. Again, and it is found out by screening mechanisms, like what you said, we just check the blood pressure for some routine procedure or something like that. However, there are some people who do get symptoms, but if they do develop symptoms, it actually is a sign that it may be too late, or something that they have developed a complication of high blood pressure already. For example, they can get headaches, they can get vision problems, they can get giddiness, dizziness, chest pain, shortness of breath, etc. Multiple symptoms are there, but as I said, it could mean that you have already had high blood pressure over a period of time, which has then developed onto complications as well. So, 80% of the time, actually, those who have high blood pressure will not have any symptoms at all.
That's one reason why I wanted to bring this program to our viewers, because blood pressure being so prevalent can be a silent killer. Most of you won't have any symptoms and signs until when you do develop it, it might be too late, as Dr. Ratnayake just mentioned. So, it is always pertinent, especially if you have had a significant family history of high blood pressure, heart disease, so on and so forth, to screen yourself regularly, because it is not an invasive procedure, it is quite simple. But talking about screening, sir, there is another phenomena which our patients do not really know about. When they come for a regular checkup, or when they come to get medication for another condition, on incidental finding, we find that their blood pressure is elevated. In our medical community, we talk about this phenomenon called white coat hypertension. So, just for the benefit of our viewers, if you can elaborate what this white coat hypertension is.
Yeah, again, it is quite a common phenomena as well. So, white coat hypertension, as you said, happens in those who come to hospitals or to a doctor's clinic for some totally different problem altogether, and they check the blood pressure, and the blood pressure is found to be higher than those thresholds that we spoke about earlier. Again, however, if you check their blood pressures later on, or maybe at home, the blood pressure is normal. So, again, it is something that we need to look into, though we cannot ignore it for a couple of reasons. Obviously, so we need to be certain that this is white coat hypertension. So, because it could be hypertension as well. So, the best way to know whether this was white coat hypertension or actual hypertension, as I say, basically is the same test that I mentioned before, the 24-hour ambulatory blood pressure monitor. So, when you do a 24-hour ambulatory blood pressure monitor, you can get an idea as to how the blood pressure behaves, and the pressure may have been high at the time that they were in the hospital, but once they go home, they are more relaxed and the blood pressure comes back to normal. And we can get, as I said, the average 24-hour blood pressure measurement as well, and that will give us our diagnosis. Another point that I would mention, though, Dilshan, is that despite the blood pressures in a person who has had white coat hypertension, where it is the stress of the hospital, for example, that raises their blood pressure to an abnormal value, they do not need treatment per se. However, it is not necessarily a benign condition, benign meaning it is not benign, because there is an intermediate cardiac risk. So, basic what I mean there is that, for example, people who do have persistent hypertension have a certain risk of developing heart problems, heart attacks, etc. So, we can't just brush it off and tell them do not worry, you are perfectly fine. There is a slightly increased risk of getting some heart trouble in the future as well. So, we need to advise them also on certain measures on how to prevent this high blood pressure from happening again, and I believe we will be talking about that a bit later in our talk as well. So,
Yes.
just wanted to mention that at this point.
Right. Now, if we do diagnose a patient with high blood pressure, I am sure in your day to day practice you may be coming across so many. What would be your approach in treating these patients? I am sure one treatment won't fit everyone.
Correct.
So, what would be your approach in treating?
Yeah, that is a bit of a complicated answer I guess I have to give, but let me try to simplify it as much as possible. So, the first thing that we need to decide when any patient comes to the clinic and we find that they have high blood pressure is if or not they actually need treatment basically. So, as I said, we need to be conclusive with our diagnosis. We need to be 100% certain whether they do have hypertension or not. So, because of that we do run a few tests to find out. So, as I said, ideally we would do this 24-hour blood pressure monitor, or we would ask them to come to the clinic a couple of more times to check their blood pressure to be certain that it is persistently elevated. Apart from that, we need to also look into certain of our organs to see if there is any effects of high blood pressure already. So, again we can go from head to toe to know if there is any hypertension associated damage to these organs. So, for example, to the brain, we can look at the blood vessels that go to the brain by doing a scan. The heart, again we look at the thickness of the heart muscle to see if there is increased thickness or enlargement of the heart, which can be a consequence of high blood pressure. We can look at the kidneys again by simple blood tests to see if they have any impairment of their kidney function. So, those are some organs that we look at, some basic investigations to see if there is any effects of high blood pressure, because if they do have those effects, that means they will definitely need some sort of a treatment. Then after that, then the decision of whether they need to be treated or not. So, again, more than the medications that people sometimes dread having,
Yes.
We need to again speak about the non-pharmacological or non-medicine kind of interventions that we can do, and I think that is very, very important and sometimes forgotten, because it is something that we need to always educate people on as to how to treat hypertension without medicine, and sometimes it can be done as well depending on the blood pressure value rather. So, for example, in a person who is young, who does not have any other risk factors, as we call it, for example, they do not have diabetes, they do not have high cholesterol, they are not obese, they do not smoke, etc., who are younger than the age of 40 years, for example. So, they are reasonably fit people, and if the blood pressure is less, the systolic is less than 160, and if the diastolic is less than 90 rather, we can consider only certain lifestyle interventions to get their blood pressures controlled. So, what are these interventions? Again, to just keep it simple, diet and exercise. So, again, diet wise there are certain things which I bit too long to discuss at this point, but simple things, and the most important thing is salt restriction. We need to ask them to reduce the salt content, and as Sri Lankans we are guilty of having very high salt in our diets, I think. So, we need to start there. It is something that I usually educate patients on, to reduce or restrict, not to have food without salt obviously, but to restrict salt as much as possible and to avoid foods that have added salt in them. And again, exercise, physical activity, again very important as far as high blood pressure is concerned. So, the recommendation is 30 to 45 minutes of moderate intensity physical exercise. So, for example, a brisk walk, jogging, cycling, etc., for 30 to 45 minutes a day, 5 days of the week, and that has been proven to be very useful in the reduction of high blood pressure as well. So, a good diet and exercise as far as lifestyle interventions are concerned, and of course, other things such as alcohol, you need to ask the patients to if they are excessively using alcohol, to obviously reduce the alcohol intake, and smoking cessation very important as well as far as high blood pressure is concerned. Following that, we give, for example, it's a patient who is having that type of blood pressure, and we give them a few months, maybe about 2 to 3 months, and if the blood pressure is adequately controlled, then we are good to go. However, there are patients who, despite these lifestyle interventions, they will require some sort of medications. However, there are people apart from that who will require medications from the start itself. Right. So, for example, if their starting blood pressure is very high, for example, if the systolic blood pressure, the upper value is 160 or more from the start itself, or if the diastolic blood pressure is 90 or more from the start itself, generally that means that they will need to be on some medications from the start itself. Apart from that, even if the blood pressure is lower than that, they have other risk factors which we just spoke about. They are diabetic, or they have had a heart attack or a stroke in the past, they have kidney problems, etc. Those type of patients, whatever the blood pressure reading, if it is high, will require medications to get it under control, and the whole point of starting medications is to obviously prevent further complications in the future.
Right. So, that is a very comprehensive answer given by Dr. Chamara Ratnayake. Like I mentioned before, blood pressure is not just a number that appears on the apparatus that checks your pressure. It is something that will cause many and varied effects, undesired effects on your organs, especially your heart, maybe your brain, kidneys, so on and so forth. So, lifestyle modifications, like we said, the modifiable risk factors are a major part when controlling this pressure. So, always do your exercises, have a healthy diet, do not smoke, and of course, alcohol consumption is there is a bit of bone of contention there as well, but as doctors we cannot recommend that you use alcohol as well. So, moving on with our discussion, sir, talking about treatment, we know that with the onset of treatment for blood pressure, there may be certain side effects involved with that as well. Just for the benefit of our patients, if you can just give them an idea on what possible side effects that may be there, so that they do not get alarmed on starting this treatment.
Yes, I think that is again very important, because it is one of the commonest questions that we are asked when we prescribe medications. What are the possible side effects, and whether we should worry or not, or alarmed by them or not. And before I talk about these side effects, Dilshan, I think it is important for the general population to understand as well. Whenever we prescribe a medication, be it for high blood pressure, for cholesterol, for any disease as well, we go by the mantra that, does prescribing or by taking this medication, will the benefit of taking it outweigh the risks? We have, that is something that will always be in our heads as responsible doctors. We need to always think to ourselves, by giving or prescribing this medication, will the patient benefit from it rather than getting side effects from it, for example. So, and if the answer is yes, and if only it is yes, do we prescribe it? Yes. Yeah, so that is number one. So, I think we should always tell the patients that, we give it because of this very reason. And as I said, the reason, for example, in high blood pressure is, I am giving you this tablet because it will help you and prevent you from getting a heart attack in the future, and that is the reason why, and you are at high risk of getting it. The side effects may happen, but the benefit of taking it is much more. But it is important for us to understand some of these side effects as well, just to get a bit of awareness. And again, the side effects of these medications differ from the type of medications that we give as well. So, it is a little bit of a difficult question to answer, but I try to again elaborate it as much as simply as possible. So, for example, there are certain medications that are considered first line medications where we start off by prescribing, and some rare side effects. For example, there are these blood pressure medications called ACE inhibitors. I can give you some generic examples for enalapril, ramipril, etc. They end with the term pril. A lot of patients are on it as well. So, one of the commonest side effects of this is they can get a dry cough. Again, it is not a life threatening complication per se, but they can get it, and if you report it to us, we can find some sort of an alternative. Another, I would say, a very rare complication, and it could be life threatening of course, is that they can also with the same medication develop what we call allergic reactions, anaphylaxis. So, we need to be aware of it. So, when we always advise the patients, if they develop certain symptoms such as difficulty in breathing or swelling of the tongue, for example, after taking it for the first time, that can potentially be an allergic reaction, come to the hospital immediately for treatment. So, that is one of that group of medications, that is one possibility. Then the other type of medications, what called the calcium channel blockers. So, again, for example, amlodipine, nifedipine, cilnidipine, for example. So, those are another first line type of medications that we use, and again commonly used as well. The commonest side effect from them of course is that they can develop leg swelling. Again, not a life threatening problem, can be aesthetically problematic for people, I guess. So, they do report it to us, and again if that is the case, nothing to be alarmed about, we can find certain alternatives. However, whatever said and done, as all blood pressure medications are concerned, probably the most common adverse effect that they can get of course is that blood pressure becomes too low. So, that is probably through and through in most patients who we prescribe tablets, it can happen as well. So, and when that happens, they feel giddy, they feel faintish, etc., and they come and report that to us, and when we measure their blood pressure, we find that it is low, and that is basically because the blood pressure to the brain is inadequate and they feel giddy and dizzy, etc. So, again what we have to do in that case is evaluate the patient and maybe adjust the dosages of those medications that we have prescribed. And as a rule of thumb, generally what we do is we start ask the patients to take their blood pressure medications starting at night, because the reason is there is a phenomenon called postural hypotension, where when the blood pressure actually drops when they stand up from a sitting position, and that is kind of a normal reaction, but it is exaggerated in people who take blood pressure lowering tablets. So, in the daytime, for example, if you take your blood pressure lowering tablet in the morning and then you have your normal day and you are sitting and then you stand up and the blood pressure can go down and you can feel faint, etc. But when in the night you are generally sleeping for a long period of time and your body is able to adjust and adapt to these new tablets and lower blood pressure values over that sleeping period of time. So, generally as a rule of thumb, we start the blood pressure lowering tablets at night.
So, talk about postural hypertension, sir. Now, a person who is prescribed with blood pressure lowering medication on the first occasion, is there any precaution that they should take when waking up in the morning? Because like you said, when they get up from a lying down or seated position, the blood pressure might suddenly drop.
Correct. Yeah. So, the simple precaution is to do it slowly. Basically, we tell people who are starting blood pressure tablets not to sit up or stand up from a seated position or from bed as habitually we do. We just suddenly wake up from bed and we walk out, isn't it? So, rather than doing the habitual thing, we just ask them to maybe from bed, from sleeping position, just to sit up for a couple of minutes maybe, and then slowly stand up out of bed and do it. So, if you do it slowly, the risk of getting postural hypotension is quite less.
So, let me emphasize once again about what Dr. Chamara Ratnayake said. your treating doctor will always weigh the pros and cons, the risks and the benefits before they prescribe a certain medication for you. So, and they will always explain why that is being prescribed and for how long, because in our day to day practice, sir, sometimes we see patients going on with the same prescription for years at end without being followed up. They say my doctor prescribed these medications, so I am on it, I have blood pressure, regardless of any other complications that they may have developed along the way. So, what is your advice? Should a person just take that medication lifelong, or how often should they come back to you?
Yeah, again, it's something that needs to be addressed. It's quite correct. So yes, they need to be followed up, Dilshan. I think that's the most important word that you mentioned there. So follow up means you need to keep them coming into your clinics ever so often, maybe once every 3 months or so. Again, to check what their blood pressure is like, because again blood pressure behaves very strangely sometimes. Some people need multiple tablets to get their blood pressure adequately controlled. Some people just need one tablet and it's controlled for a long period of time.
Yeah.
But we can never say. Again, the reason is, as I said before when we started off as well, high blood pressure is a silent killer, as you mentioned yourself. We never know whether your pressure is low or high sometimes, because people tolerate it very well. So the reason for follow up is, again, just to simply check the blood pressure, see what the control is like, and again to adjust the medications. We can maybe reduce the dosages of medications, we need to increase the dosages to the so called optimal level, and sometimes we need to add on certain medications to get the blood pressure adequately controlled. The toughest part from our point of view, of course, is to convince patients on adherence, essentially to convince them that they need to be taking tablets on a regular basis for a long period of time, and that's kind of a challenge for us in a way, because a lot of people I do find in my own practice as well, where they are found to have high blood pressure, we prescribe them a medication, they take it for a few months maybe, they get their blood pressure checked, find that it's normal, and they think hallelujah, everything is nice and dandy, my blood pressure is okay now, it's under control, yes, I can stop my medications, and they stop it on their own without getting the advice from a doctor, and then unfortunately they come in a few weeks time or a month's time with some sort of a complication, a heart attack, or worse than that, a stroke. So the message here from me is very important, that high blood pressure or hypertension is not a curable disease.
Exactly.
And that's it's not an infection, it's not something where we can give an antibiotic and clear. These are what we call chronic diseases. So chronic non-communicable diseases. So these are diseases that need to be controlled. So control means that they cannot be cured, but we can keep it under control, and how? By obviously maintaining good lifestyle measures, as I just said, and also to adhere to the medications that your doctor has prescribed, and allow your doctor to adjust the medications as they wish. Maybe they can reduce the dosages, increase, add tablets, but the doctor should be able to give you that advice rather than stopping the medication. So that's very important.
Exactly. As we always emphasize here on Healthline, you should not stop any medication by yourself. Let the burden of that decision lie with your treating physician, and the changing of prescriptions or changing of any medication should be done by a properly qualified medical practitioner. That is something that we always reiterate here on Healthline. And like Dr. Chamara Ratnayake said, high blood pressure is not curable. It's something that needs to be controlled, and if not controlled properly, can have very undesirable effects like a heart attack or a stroke. So having said that, sir, now we hear about blood pressure related to pregnancy. It's sometimes called pregnancy induced hypertension. Is it the same phenomena that happens as in another patient, and will that high blood pressure continue on even after the cessation of the pregnancy?
Yes, it's again something important to discuss. As far as the the reasons to get it, it's similar in a way, but there are certain other added problems. Obviously, in pregnancy there are certain hormonal imbalances as well that could potentially lead to higher blood pressures. And again, genetic predisposition, as you call it, family history also plays a part. But yes, so and again the diagnosis of pregnancy induced hypertension is a little different. Our thresholds are a little bit different as well, but the most important thing is we are dealing with 2 lives here. So, we need to know how and when to treat, and the treating physicians will generally do the necessary there. But again, the treatment options, the tablets that we use, for example, to keep blood pressure control in pregnant ladies are a little bit different to normal population, because certain medications given can be detrimental on the fetus. So, we need to be careful about certain medications that we use. However, the treatment goals and the follow up etc. is all the same.
Now, talking about high blood pressure, sir, we also associate it with this condition called the metabolic syndrome. You mentioned some of it, some of the diabetes, the high cholesterols. If you can just elaborate what this metabolic syndrome is and how all these conditions may come together with another, and what kind of effect that has.
Yes, so metabolic syndrome is something that's quite common in the South Asian population actually, and it centers around people who are overweight or obese essentially. So, that's kind of the essential criteria to diagnose metabolic syndrome. And what we mean by obese also is the so called central obesity, which is again common in the South Asian population. Abdominal fat. Our South Asian population has more abdominal fat compared to fat in other parts of the body, and that leads to certain complications, certain hormonal changes. And along with this central obesity, there are other features as well. So, high blood pressure, high cholesterol levels, and high blood sugar levels. So, those are like the components of the metabolic syndrome, and it's kind of a combination of everything together. And the importance there is that it's kind of a all in one package almost of getting all these risk factors that can potentially lead to cardiovascular disease or heart attacks and strokes etc. So, it's something that we need to address and treat. If a patient has been diagnosed with metabolic syndrome, we need to take each of those components separately and get them under control.
Right. And as all of you know, we Sri Lankans are going through very turbulent times, and it's very stressful these days. You have to stay in full queues, you have to go and find your gas to cook your meals, inflation is skyrocketing. With that, the stress levels have really gone up, sir. And I have seen certain articles in mainstream media where certain of these treating physicians have said that with this situation, the risk of heart attacks also may have gone up. So, what is your advice to our viewers, the diagnosed and maybe the undiagnosed as well with hypertension? Is there anything that they can do to prevent undesirable effects of hypertension? What is the effect of stress?
Yes, unfortunately, stress is, I guess, I would like to say it's a controllable risk factor, but it's probably out of our control at the moment, isn't it? So, yes, so it's not something that is necessarily in our control, but it's our response to stress is probably what is in our control.
Exactly.
So, it's how you deal with stress and how you try to manage it yourself. There are multiple ways that is probably beyond the what our talk is about today. However, to answer the question, does stress affect the heart and does stress affect high blood pressure? The answer is yes. Stress definitely does play a huge role in causing heart trouble, heart attacks, and high blood pressure, etc. And especially sustained stress, which we are experiencing at the moment, isn't
Unfortunately,
it?
Yes.
So, it's something that we need to obviously take into account, but again, I think it's more about how as individuals we deal with the stresses that are delivered to us, and I would probably say that we need to and it's something that has been proven to be very effective in controlling things like high blood pressure, this principle or this phenomena of mindfulness.
Yes.
So, mindfulness is a very complex topic altogether beyond the scope of this talk obviously.
Yes.
However, people who practice mindfulness, I do believe and I have seen myself have better control of their life, better control of their blood pressure and overall well-being and health. So, I think we should always advise people, hypertensive or not, if they are having stress, which they probably are, the art of mindfulness should be something that we should try to practice.
Definitely, as we are trying to navigate ourselves through these troubled times, it's always pertinent that you don't lose focus on your health, because with all the problems that's going around across the country, it's very easy to lose focus and have undesired complications of whatever condition that you may be you are treated for. So, it's always pertinent, and that's why we continue to bring these sort of programs to you, so that you have an understanding of what the treatment modalities available for you are, when you should be taking drugs, what kind of investigations that you will have to undergo. So, it's always the message is don't lose focus on your good health while we try to navigate these troubled times. And with that said, with the time constraints that we have, we are coming towards the end of this program. But before we wind up, what would be your take home message? I'm sure we discussed so many things in depth and there were so many important points, but for our viewers, what would be your take home message?
I think it's a couple of things I would probably say. So, as we spoke, just to summarize things, I guess in a way, so hypertension or high blood pressure is in majority of the of people, it's asymptomatic. As I said, they don't feel it. So, it's something that we need to be aware of as far as finding out whether you have blood pressure or not. So, get yourself checked, get yourself screened. As I said, probably a good age would be say, from the age of 30 years onwards, especially if you have a family history of high blood pressure, and certain investigations just to make sure you are overall healthy as well. Obviously, apart from the blood pressure, get your cholesterol levels checked, get your blood sugar levels checked, etc. I think that's a good thing to do, especially in this day and age. And the other important message, as I said, in those who have already been diagnosed with hypertension, to get it controlled. We cannot cure it, we can control it, and that is by maintaining good lifestyle changes, good diet and exercise, and also adhere to your doctor's advice. The medications need to be taken regularly and can be changed only by your treating doctor, not yourself.
Definitely. So, as we discussed, hypertension is a silent killer. It's always pertinent that you get followed up, by a properly qualified medical practitioner, and you adhere to the prescription of drugs that they advocate for you. Having said that, it has been a great honor and privilege to have Dr. Chamara Ratnayake here tonight in the Healthline studios. On a personal note, I have learnt my ABCs of medicine from him at one point of my medical student career as well. So, it is with great honor and privilege that I thank you again, sir, for gracing our studios and educating our general public about this very, very important topic. So, my heartfelt gratitude to you, sir.
It's been my pleasure, Dilshan. Thank you very much for inviting me as well, and I'm very happy to see that you are in this type of position in the country as well, and I can only ask you to do further, because it's very, very important, these type of health talks, educating the public on certain health topics will only be beneficial overall to the health of the country as well. So, thank you very much for what you are doing as well.
It's my pleasure, sir, and thank you once again. With that, we have to wind up from this edition of Healthline. As I said before, we are going through turbulent times, but don't lose focus, keep fighting the good fight. Until I meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, wishing all our viewers Aibowan.